UK time. So let me just say a few words about Yusuf Sayed. Yusuf is a professor of international education and development policy in the Centre for International Education here at the University of Sussex, and will be taking over as the centre's director from January 2021. He's had a long and illustrious career, internationally recognized for his work on teachers and teacher education, global education policy and education policy in South Africa. Like many researchers in our field, he has moved from the policy world to the academic world and back again throughout his career, with stints at both UNESCO, the Global Monitoring Report, and DFID, the Department for International Development. He has also been influential in advising the UNESCO Teacher Task Force and supporting Education International, the global teacher trade union federation. In 2018, Yusuf won the prestigious South African Education Research Association, SAIRA, Research Honours Award for his lifelong contribution to research on South Africa. Thank you very much, Yusuf, for taking time today to present your thinking on the COVID-19 education relationship, and the Zoom is yours. I will stop sharing and pass the screen to you.
Let me unmute myself. Thank you for that very kind introduction, Mario, and very generous introduction. Clearly, I'm going to get Mario in future to introduce myself all the time, as well as being my neighbor in the office across the room. Okay, so I'm going to talk for about, hopefully less than that, but what I want to talk about is what I have been interested in and working on is the idea principally around policy making in general, but policy making during the times of COVID-19. So that is primarily the driver of this talk and the papers we did, and I'll come to that just now. And the questions that we've attempted to address in this talk and in the research we've been doing around COVID-19 is who gets to make choices in education during the times of COVID-19 pandemics, crisis, and who are the participants in the policy-making process? What is the role of teachers? What is the role of academics? What are the role of social movements? Those are some of the questions that we're trying to answer. In addition, what we're trying to do in this presentation is look at the kind of choices that are made during the times of the pandemic, but generally crisis in general. So in this talk, I'm going to talk about 4 parts. I'm going to talk about pandemics and crises as interlocking. I'm going to talk about how policy is made during times of crisis, review some of the policy choices, and then look at crisis as a moment of opportunity and a chance to rethink the policy imaginary for education. Now, the talk is based on several papers we have done and are concluding. Masina Singh, myself, and a few colleagues at the Center for International Teacher Education have been working around the issue of COVID-19 and education at several levels. We've written a paper for the Southern African Review of Education, which I'm drawing on now. We've got a paper coming out in the Journal of Health and Social Policy around policy making. And we've also been working with Education International and Open Society Foundation around COVID crisis and teacher professional development and curriculum in Africa based on 8 countries, South Africa being one of them. In this talk, I'll primarily select data and information from all the pieces of work we're doing, but principally look at South Africa. Let me start by making a fairly obvious comment about the pandemic. In a sense, it's not like we haven't had crises before. Crises have always been around. They've either been natural disasters, as in the tsunami, or we've had crises around political instability or context of crisis. What has marked out COVID-19 in particular as a crisis is that it's generalized the experience of a few to everybody. in a sense, even though everybody has not been affected equally, the fact that it's affected everybody, either in the form of lockdowns in countries or school closures, have caught the imagination of policymakers and public. But it's not like refugees haven't been locked out of education before. It's not like children in conflict have not been denied education for a long time. It's not like the children haven't been hungry or the poor, impoverished have been locked out before. So in a sense, the pandemic is not different from other crises. The one difference being is generalize the experience of a few to the many. And that's why it's caught so much of public attention, which is the first point we're making, that I'll skip the slide. The first point we're making is that the pandemic is a set of interlocking crises at the heart of which in the paper we argue is inequality and what we call the excessive effects of agrarious forms of capitalism, or crisis capitalism, as people spoke about. And this crisis, as an interlocking crisis, we in our paper talk about 4 dimensions of it: as a health crisis, as an environmental crisis, as the impacting conflict context, and crises of global public goods, for example, water. In a sense, the pandemic intensifies and exacerbates existing forms of inequalities, as well as exacerbates and intensifies existing crises. For example, in Somalia, the crisis of COVID comes at the same time as environmental degradation as well as conflict. And in this sense, what the important thing about these crises are, and here we quote the Gates Foundation's latest report, all these catastrophes, and in the paper we talk about it, are fundamentally undermining the progress made, particularly around SDGs in general and inequality. And in particular, the pandemic hurts people of color the most, the marginalized, and the oppressed the most. They are getting, sorry, let me just move the slide screen out. They are getting sick and dying from COVID and suffering its economic consequence at a much higher rate than white people. According to the US Census Bureau, 23% of white Americans said they were not confident they could make rent in August, a frightening enough statistics. But by contrast, Black and Latin American, the number was almost double that. So clearly, while the crisis has impacted all, it's disproportionately impacted more adversely those who are marginalized, those of color. Sorry, let me just get to the next slide. So sorry about that. Further on, the report goes to talk about the economic consequence of the crisis, how much money governments are able to spend on the safety net, and people are suffering. The Institute for Health Matrix and Evaluation estimates that extreme poverty has gone up by 7% in just a few months because of COVID-19, ending a 20-year streak of progress. Already in 2020, the pandemic has pushed almost 37 million people below the US $1 to $2 a day extreme poverty line. Now, while we talk about the poverty line, the reality is that it's set low, and what it really means in real terms is harder for most people. So in a sense, we argue in our paper that the current crisis and pandemic is as much a crisis of the environment as it's of health. Mitchell, in 2020, astutely notes that COVID-19 is a stark reminder that our assault on the natural world has consequence. Humans may not have created the coronavirus, but we have cultivated the unnatural conditions needed for nature to toss a $10 trillion time bomb into our economy. In other words, what the argument is that the pandemic is both a cause and effect of existing frailties and inequalities in the global order, as well as of existing conditions in the global world and within nation states, which is why we talk about in our paper the idea of the pandemic as part of an interlocking crisis. global in cause and effects, but disproportionately impacting the poor, the marginalized, and the disadvantaged greatest. Now, what has been really interesting in this, and in our work, we talk about how public policy arises in this context and how evidence and advice from a wide range of stakeholders are considered. Yet in the research we've done is that it's been a very narrow group of people who've made educational policies, and generally policies around COVID in particular. And in the paper, and I can come back to it in question time, we talk about how the hard sciences and the natural sciences have dominated policymaking during the time of COVID-19, and in particular marginalize the social sciences and the critical social sciences in particular. Where social sciences have been brought into the picture, it's been largely behavioral scientists who've been brought in to look at how people would respond to particular interventions or actions of government choices. For example, how do people respond to lockdown? How would learners respond to lockdown? Now, in South Africa, when we looked at that, what was interesting is South Africa set up a committee called the Ministerial Advisory Committee, similar to SAGE in the UK. And in the initial review of this committee, of the more than 50 representatives on that committee, largely the majority were from the medical profession and largely policymakers. But what was significant about the way South Africa dealt with the pandemic and the Ministerial Advisory Committee was not very dissimilar to many other countries, which invoked disaster management regulations to make policy. In a sense, democratic process got silent to an extent by invoking the regulations around managing these as emergency and disaster contexts. This approach by the South African government mirrored the global trend to source advice from local command councils and rely largely on certain kinds of advice. And in fact, the trade union movement who we interviewed in South Africa said that we played a very limited role at the start because the government used the Disaster Management Act to close areas of consultation. We had to force to be consulted. The government was not doing that, and we had to force the government to ensure that on any education policy we were consulted. Clearly, part of the issue around COVID has been the ways, and we need more research on that, how social movements have been activated or should be activated to ensure that the policymaking choices are more democratized. Science, as I said before, has been invoked, right? Yet science is often contradictory, and it often has multiple perspectives and outcomes, right? One such contradiction, if for those who've been following the debate around COVID, is the lack of evidentiary consensus and arguably great misuse of science in the debate surrounding the misuse of hydrochloroquine as a vaccine, right? And in that sense, there's an assumption within government and in South Africa in particular, that while we call upon the science fraternity to advise policymaking during times of crises, as is happening in the current pandemic, scientists do not have all the solution. As with social science, the orientation of their research varies, often leading to different and sometimes contradictory views. The idea that science in and of itself, as I'll show later on education, can resolve many of the questions around policy is misplaced. And we argue that decision making based solely on science cannot be the basis of informed decision making, especially if the science on which the evidence on which it's based is contested, partial, incomplete, and often framed ideologically and politically by the very research community that generates it. And one of the interesting things is the role of pundits and advisors in this. And here there's been very interesting examples. One of the particular one in South Africa, when one of the members of the Ministerial Advisory Committee, Professor Gray, who also chair of the South African Medical Council, publicly rebuked the government for its stance on lockdown. In other words, while she was appointed on the panel of providing evidence to advise government, she used this knowledge to argue that the policy choices government was making was wrong. I'm not going to go into the merits or demerits of whether she was right or wrong, but what we talk about in our research is that her intervention conflates the roles and runs a risk of misunderstanding the different knowledge bases and rationalities of researchers and policy experts on the one hand, and government policymakers on the other hand. We talk in our paper about massive policy overreach, and we talk about the policy overreach of experts and pundits who somehow believe that what they say, therefore, must be what should be the claim to the truth. And in particular, we quote Maths 2020, who contends that in times such as the current pandemic, but generally in crisis, we are faced with competing imperatives. And we need to balance the diverse interests of society between education and economy, between freedom and choice on the one hand, and between public policy ones. And Maths goes on to argue that philosophers of justice argue that how to allocate benefits and burdens in ways that are fair. Such issues abound in the context of COVID-19. Consider here debates concerning how to balance the interests of the elderly against those of the young. If most of those who die from COVID are older than 19, while Africa has a relatively large population of young people, how do you make a trade-off between them in Africa? And in particular, we argue that this knee-jerk reaction to justifying policy choices on hard science inadequately and mistakenly ignores contextual issues and the social challenges, which ends up, as I'll show later, increased social inequities. Sorry, let me just, sorry, I went a bit too far back. And here's an example of what we talk about, policy linearity and mistakes. You know, there was a big debate like everywhere and right now in UK and South Africa where the schools should open or not close. And there were two groups of people who were arguing for school reopening. There were a group of academic on the one hand, Van der Berg and Spol, but we found most fascinating the South African Pediatric Association. We did a discourse analysis of their advice to government on school opening. This is a direct quote from their long memo to government. They said the relatively scant and weak quality of available evidence, particularly from resource-poor settings about the effects of school opening, but they still ended up advocating for schools to reopen in South Africa. Thus, not considering the unequal landscapes of schooling in South Africa, including the fact that many schools do not have clean running water or proper hygienic infrastructure to help mitigate the spread of violence. So SAPA as an association, we found really interesting at the level of policy in overreach and how they dealt with it. Now, what happened in South Africa and school closures and school openings? Schools were closed in around March 2020, and in South Africa, it worsened inequalities for working mothers. It also directly impacted learners in ECD centers which had to be closed. And in fact, this has been one of the blind spots of the debates around COVID-19 and education. While understandably there's been a focus on schooling, less has been said about the closures of ECD facilities and early childhood care. School feeding schemes cease operation. Gender-based violence increased. The number of reported cases in that Childline said between March 2019 and 2020 increased by 67% and grew more so during the time of the pandemic. In fact, by mid-April, about 1.8 billion students in the world were affected by school closures, impacting around 99% of the world's student population. That's been one of the fascinating things around COVID. It has almost resulted for a period of time the total closure of schooling as we know it. Schools started reopening in South Africa in June 2020, and we interviewed several people about, including unions. So what South Africa did was they, like many other countries, they had a staggered return to schooling with the idea that a number of schools learners attend every 2 or 3 days, firstly. Secondly, only certain grades, particularly those that were at the terminal phases of schooling, either at the end of basic or at the end of secondary. Now, here's what the unions told us. So we ended up adopting a system that says we must have 50% of the school back at a time, so that we split every class by 50%. In theory, that tends to social distancing, but in reality, that doesn't, because many of our schools, including in wealthier province, still have classes in some of our areas exceeding 60. So even if when you split the class in half and you have a class of 30, you still have too many pupils for social distancing. Clearly, at the poorer end of the schooling sector, the idea of school reopening with socially distanced measures is not viable in many cases. What's been fascinating has been how curriculum assessment been dealt with during the pandemic. Here's a review we did about global approaches. Generally, there's been such a strong push to, at one level, to maintain exams, reschedule it, and where there's been an attempt to rethink orthodoxies around examinations, they've been positive but limited. Here's a report that came out today from the Center for American Progress for the US. They argue for no waivers of the federally mandated administration of standardized testing in spring 2021. And the UK government in England and Wales this morning said in England and Wales, they want to hold on to the idea of an externally administered GCSE. Glass in Berlin puts it very aptly. The idea of holding on to golden standards of externally examinations to assess progression and validation of learning is ill-timed, tone-deaf, and disruptive. Clearly, there's no way in one which can think about examinations in the way they currently schedule, whether in any of the regions of the world can occur in ways they are doing. In South Africa, there's been an attempt to cancel grade 12 learner exams, although that hasn't really occurred fully. Yet what was interesting in South Africa, schools were allowed to trim the curriculum, right? But there's been an overwhelming discourse in curriculum assessment globally and in South Africa with the idea of learning days lost, as if content learning is the only thing that happens in schools. In other words, the typical education response has been, let's worry about the loss of learning. And the word loss of learning and content loss has dominated the way in which policy choices have made. This is what the union officials say, and I'm relying heavily in this talk on unions. We do have government officials later on. I'll talk to, and in the bigger, larger papers that we wrote. The government started saying, look, it can almost cut the number of subjects. Then we, the unions, had to come in and say, no, but that means another debate, because what about the career of this particular learner? So that is not curriculum trimming. It is something else, because if you're changing the policy altogether, please read carefully, because it has unintended consequences for our economy and for our. Now, here's the interesting debate in South Africa. The unions bought into the argument to an extent about content learning. However, they did point out something very important in this quote, and we talk about it, that the idea of loss of learning and the idea of catch-up learning has disproportionately impacted the impoverished more than middle class with the required cultural capital. And in the paper, we talk about that the middle class have benefited from school closures and home learning more than the poor. Teacher support and professional development. In the research we've did in South Africa and globally, very little support is provided to teachers and learners in terms of effective support system. Online resources are made available to teachers, and as I'll show in the next slide, they're really not effective. Here's what the quote says from a government official. Well, this is where the biggest problem lies in terms of psychosocial support. It's all about resourcing at the end of the day. For example, in the Free State, when we questioned about the psychosocial support, the Free State said, yes, we are ready. This is one of the large provinces in South Africa. But yet we only have one school psychologist in the province and 2 social workers. That is, in the province, in our department, we have 3,000 schools with 3 people who are, if you like, with the required psychosocial support, either in form of school psychologists on social workers to service the entire school population. Then they agree that we'll get people from other cross-sectoral departments like social development. The reality, as the officials say, this never happened. Clearly, what's occurring is that the extent and coverage and reach of psychosocial support is limited. Now, online education, everybody's talking about. In the paper, we talk about it as a private solution that found the public problem to attach to. Radio and television, online learning, mobile technologies have increased. A lot of this is proprietary in nature. A lot of the platforms like Microsoft Teams, Skype, Zoom, like this one. In fact, the income, if you look at the latest income earnings of Zoom, you'll notice that their stock prices their shares and their dividends have gone through the roof. Clearly, what this has done is big tech companies have seen a very huge advantage, in particular from the COVID-19. And I think one of the difficulties that we'll face is how do we cope and manage and mitigate the growing privatization of educational approaches through edtech and the rise of big edtech, both in terms of the hardware, such as computers, or software such as Zoom, Teams, Skype, or in terms of the content that it gets put on in broadcast, in radio or TV. This is some of the quotes. Government officials say is we've made resources available in the middle, but ridiculous things occur. For example, in public television, you have lessons for your grade 5s at midnight because that's when you get free time on television. Clearly, that's not the time you expect your learners or teachers are to be up to be learning. Similarly, while there's been a lot of talk about online learning and classes that are available through online learning, the absence of internet connection or the cost of data and infrastructure of technology, which is in the hands of private sector company, has been exorbitantly expensive, making it difficult for the poor and teachers themselves to have that. And in particular, notwithstanding government's attempts to work with large data providers to reduce the cost of data to learners. In a sense, it then leads us to argue that the big tech and the online solution reflects and exacerbates the inequality. And this is a quote from the union official. The impact has been disproportionate between the wealthier schools and the poor schools, and there has been very little done to address it. And clearly, while there have been many commentators who have talked about the 21st century skills, the fourth industrial revolution, we argue that what we see globally and in South Africa, this pandemic is leaving the poor, the marginalized, even further behind than before. Now, in the last 5 minutes, I'll try to wrap this up and see where we go. We say that part of the problem of the COVID pandemic and the work we did is that teachers matter, and they've been neglected both at the level of policy and in terms of thinking. There's been very little professional development to support teachers to work in these new modalities. Policies that have been developed ignore contextual realities. There's been a blurring between, on the one hand, between policy makers, sorry, I'll go back. Sorry, I'm not sure how to use it. There's been a blurring between policy makers and policy advisors, not always positively. And in fact, there's been so much talk about new normal and we need to return to a new normal. We thought it'd be nice to capture a quote from a teacher who said, we don't need a better new normal, we want a better normal. And we need to say we need to learn from these and other crises so that when we build back better rather than build back to what we have before, including at the level of assessment. In other words, the COVID-19 and crises should allow us to rethink our education dogmas and orthodoxies, rethink our education delivery modalities. Don't forget issues of financial oversight and accountability, and make sure that we address and attend to the creeping privatization of education that the crisis has set in train. In other words, we shouldn't see this as a crisis of no choice. There is a choice. There are alternatives. And the alternatives is a policy imaginary to create a better world and a better new normal. So we end off our arguments in our papers and our research to say the crisis is in a moment to imagine a better, more just, more humane world in which we pay attention to people and the planet to secure the means and conditions for equitable, inclusive prosperity in a peaceful world. Because otherwise, all that's going to happen is the crisis becomes one more condition of inequality and continues to exist in and amongst other crises, intensifying and exacerbating and mutually reinforcing existing crises and inequality.